everyone, and good afternoon, and thank you being here this afternoon. Before I start the craniosacral therapy, I don't know how many of you already know and experience this therapy, probably not very well known. I tried with this short time and to present in the 4-part and just introduce what is craniosacral therapy, how it works with migraine headache patient, and give everyone a little bit of homework, some toolbox, like Meredith say, you can get again home to use it, and the last part open for question. Let me share a little bit today's talk. Okay, where is this? Anyway, I'm going to come back with the screen. So, but before I start craniosacral therapy, I just want to share a little bit of my migraine headache experience. About 25 years ago, I give a birth for my a healthy but rather big boy, and the labor is pretty fast, like 4 hours with 2 epidural shot, and everything is not a big even, but shortly 2 days, literally 2 days after the birth, I just have this horrible migraine attack started. As you know, in that time, I have not too much choice because I was breastfeeding, and plus of that, I have a 16 months older baby at home. So migraine is very deliberate in my life. I can't really do too much after try. I can't use too much medicine, but I reach out. I went to see a craniosacral therapist, which she also at that time it's my teacher. By my biggest surprise, I think the first session was with her. It's she's basically spent all her life, all her position in my lower back. But to put the story shorter, it's a few sessions later, my migraine just subside, and not only my migraine subside, I really feel the best well-being I never find for a long time, and there to make me thinking, wow, because as you say, I was that moment I just recently moved to US from France, and they changed the culture, changed the language, changed the job, plus start a family. So you can imagine my stress level is really shooting the very highest it can be, and also probably I negligent my own like well-being, the health schedule, and the diet. For anything this, and later on, I realized also because I rather started ski pretty late age in France. So of course I feel a lot of times in my buttocks, and I also torn my right knee. So that's why I took this story just to show maybe echo some of you stories, because when we have a migraine headaches, we're not necessarily only our head. Maybe migraine didn't build for one day, and maybe just last minute, like they tip last they drop water to get everything started. So after 25 years, I proudly say I don't have migraine attack anymore, but I do have headaches once in a while, like everyone. And that's what I talk about the craniosacral therapy, how we trying to tracing where the migraine, the original related, how it's possible we go to in this active, we say like active course there to make together. Because it was such a short presentation, I tried to get a really like slide.
Perfect, Jie. Helen has it up for you.
Yeah, can you get a show that? So my migraine headache is gone. And the next slide, please. So it's just say nothing, it's forgotten. You know, our body does have memory. They do not isolated, everything is accumulated. So we do need to take mind, body, spiritual together. Like Meredith and Dr. Bernstein already talked about it. So next. To talk about craniosacral therapy, we should know this is one of the extent of our cranial osteopath, which we say Dr. H. Steele. He is considered the father of osteopath, and he started this new medicine. His 4 key points related. It's the body, it's in it. Like I say, you know, we really relate head to toe. You can have a horseback riding, sprain your ankles, and maybe months, year later, you create migraine headache because it's a fascia link. And the structure and the function are interrelated. And the body is a self-correcting system. We all have this ability to heal. It's always amazed me to see how young babies, children, once they get a trauma or would get anything, they heal so fast. It's almost like a less layer we are, the better we have life, well-being, we heal much faster. So craniosacral therapy is really enhance this self-healing mechanism. And the last one is drugs may be harmful. Okay, next. So what is craniosacral therapy? Before I talk to this, I was talk about maybe somebody don't really know. Craniosacral therapy really, it's like it's not really like a typical massage. It's not massage. You can fall dress on lay down on the table, and you therapists just really follow your body system, and above your clothes can palpation scale to feel where the sense interacted, and trying to help you. And we use our palpation scale to get an assessment and the treatment all together. So what is craniosacral therapy? The craniosacral therapy is really, really gentle and manual technique. We usually say use 5 grams, maybe like the weight of nickels to touch with people. And the way to use that, one is safety, one is if we give such a heavy pressure there, your body will respond very strongly. So in this way, we can really know your tension, it's because already there, or maybe it's much later, just this moment, because we set contact to create the pressure. That's why we use such a gentle palpation scale. And we also follow this very subtle cranial rhythm. The cranial rhythm, it's different than your vascular, in your breathing system and the cardiovascular system. It's different system. We mostly monitor it with your central nervous system. So in the third point, we work with your fascial system through your cranial, in the cranial system, a spinal cord, and the rest of the connective tissue. The one area, many manual therapy work with the fascial system, but the craniosacral therapist, we really focus this very deepest, we say, a fascial system like a dural membrane, which you can see in this screen from in the cranial membrane and the head on the skull, and they're going to straight down with our spinal cord, and they all integrate. That's a layer of cranial fascia. We're trying to hope to release, because this fascial system, they connecting with our central system very closely. Next, please. We're back again. These three areas we focus. One is restriction, the motion, which we all know as life. We need to have a motion. Any restriction, any stagnation create a disease, but the motion create health. And the tension we trying to release. Doesn't matter which way you create tension by the trauma, about just stress, about other condition. You're trying to hope release this fascial system in the central nervous system, in the typical fascial system of our body. And the last one is improve the circulation, not only cerebrospinal fluid, which is very important to nourishing our nerve system. And as some of you probably know, cerebrospinal fluid have a very close link with our, like, for example, lymph system. The lymphatic system can help you system to evacuate the detox our system. So that's the three areas with the fascia, motion, and the fluid system. Craniosacral therapy interesting. Typically this area. Next, please. So we talk about the unity of body. It's like we need to always thinking global, and but it's like I say, with my own personal migraine headache, and with earlier physical accident, life change, and also with labor, and later on, literally they find that I have a CSF, cerebrospinal fluid leak during the epidural time. So we know this global sense, but we need acting one locally, like my first session, literally, my therapist trying to help me to restore my motion in my lower back, and be able to help me later on in my head. Okay, next. Just for fun, a little bit to say that our nature designed it, our head, our lower back, mimics their motion. So how many times we treat the people, just free the pubic bone, they can hope their joint pain, and hope their hip bone can really can help them in the head. So that's also one way to think about it, like globally. Okay, next. That's a little bit to show, even with adults, we have these cranial sutures, but not totally fuse like we say, like concrete. They still have slightly these motions, especially for the children. If they really overlap, they create a lot of intracranial tension there. Okay. Because with timing issue, like I say, our migraine headache can relate anywhere on our body to start it. But today with this timing, I only focus a little bit more some common area create more migraine headaches. For example, our neck or upper thoracic or like trapezius area. That's we can see all this referral pain from trapezius muscle that can go into in the cranial base, our forehead, even our jaw. So give everyone just visual pictures. The next muscle very important. It's we say sternocleidomastoid, which is a big muscle on the neck muscles, and you can see. Often migraine, when we have migraine headaches, we have this area is very typically to show in the picture, even in the ear. Okay, let's. I will spend a little bit of time about a suboccipital muscle. This small muscle, it's really underlying we talk about this big muscle like trapezius and other big muscle on the back for body. This small pieces muscle is here, body really designed, really why it's so many layers to go into there, because the purpose is really protection of brain system. So we need all these layers, the muscle, to protect us. And the interesting to see, next slide show the, okay, next. As you see how the body design, it's really like a bells one by one and protected with they shown the 2 by 2. They are small, but as we all know, when we have a migraine headaches, that's the area we usually contracted the most. Tension, pain usually started from migraine headache usually started with that area. They have the reason for that. For next slide to show. Because you see the small these muscles, we say inferior oblique muscles, they have really literally more than 242 sensory receptors. This sense is anything you feel, any stress and the danger, your body, your muscle is contracted right away to send a signal in our system to protect you, which was trapezius muscle, which we see this big muscle on the up thoracic, this area. I mean, on the back area, they only have 2.2. Literally, they have 100 times more. And the other one, it's the same. You know, it's like 100, more than 100 times more for that. It's like I say, it's advantage, but at the same time, it's inconvenience. If it's too much reaction, you preparing. It's like Meredith talked about the fight-flight system. You immediately already on the stress. On the same time, they cut everything else for your rest of your body. Okay, next. That's talk about the muscle, but the next area we talk about it with our nerve system. As I have this scar, I think if everyone can see it, if I take the top of the head scar out, it's not a surgery, but it just show people. As you can see, this the green area we see jugular foramen. It's this tiny hole there. The all cranial 12 cranial nerve need to go through from our head to rest of body, but some cranial nerve, very important cranial nerve, go into this tiny holes. This green area, like 9, 10, 11 for next show. If anything, the bone get compressed, and the nerve get compressed, they are going to create a physiologically response for our body. As you see these red circles, that's this tiny hole here. We see jugular foramina. It's very little, but the cranial nerve 9, 10, 11 to go. 9, 10, 11 go through these holes. And next, please. So just talk about the cranial nerve 10s. I think everybody already know the vagus nerves. Vagus nerve is really it's a response, regularization almost all our internal organs. We all know, when we have a migraine headaches, maybe have a heartbeat, or we affect our digestion issue, affect our respiratory, rate. And also we may have like reflex actions, like with sneezing, or we're, or even create emotionally, like with anxiety. So that's why as craniosacral therapists, we're really interested in how we open this area this holes, like the cranial nerve goes through without too much obstacle. That's one cranial nerve. The next cranial nerve 11, and it's also going the same hole with the ancestral nerve. The ancestral nerve, which you can see with all this red, it's all major neck muscle there. So you can do all kind of massage, tension, to do your muscle. But if your nerve didn't get free, they also come back for the tension. Next. That's also give us some trigeminal nerve is one area craniosacral therapy very interesting. Help a patient to relax all this nerve and be able to free all facial pain. Next, just give you a little bit loop. We say if we start anxiety, talk about that, and immediately we get a crunch or T. Or on the go back, and we active our trigeminal nerve and put our radicular alarm system even more higher activity. So we're going to this black loop. So create more and more pain, more and more attention. Next. So I talk about a little bit of fluid exchange. We all know when we have migraines, often we have sinus issue. Just to show, our sinus is not only behind our nose, we have all kind of major sinus in our brain system. So craniosacral therapy is really interesting to drainage all this sinus going from head to body, body to head, and back for the lymphatic system, create a better circulation. So let's give a picture just to see the area of interest. So next. It's like a child drawing, but also to show, because the fascia system, what craniosacral therapy interest, it's we are body designed for this longitudinal fascia, but also a lot of rings, like our diaphragm or joints, but this transverse fascia, it's a little bit, we say like a traffic jam there. So if by any reason we get tighter, so we're impact all rest of the body. So we spend a lot of time to release all these rings. Next. The one area I don't address today, but I do say in the craniosacral therapy, a lot of people, we do like a memory release, memory not on the head, and they do memory when we have trauma, when we have any accident, the memory storage in our body, even cellular level. When I work with veterans and the PTSD patients, and they do come out with a lot of emotion release. Even yesterday, I have a patient just sent me some notes that talk about after first the craniosacral therapy, she went to this vivid dream, which right now make more sense to see, because I was they are related. So I usually told my patient, anything can be happen after craniosacral therapy treatment, but it just give you permission. Can be physically you feel it, emotionally you feel it. Okay, next. So the third part I want to take it just some self-treatment at home. As you see, this we talk about still point inducer, and then Meredith talk about the Dr. Bernstein talk about homeostasis, and Meredith also talk about all meditation. We can also, in our craniosacral therapy treatment meditation, we use some tools. So literally, this is just like a 2 tennis ball. For my 30 years practice, I really think a tennis ball probably is the best, better than other balls. Some too soft, too hard. And you put it on the socks, a little bit heavy socks, tied together. And the best way to use it, it's, take off your pillow, lay down on your bed, and you put on it on your cranial base. And please don't take it too low on your neck, but take higher in the in the cranial base, like an occiput area. So you can lay down there about 5-10 minutes. At the same time, you can do any wonderful meditation and methods show us. And to do with 5 minutes, 10 minutes, they restart your homeostasis and also re-regularize the autonomic nervous system. And at the same time, can take care of all we talk about this small muscles, can troublemakers, and can relax them, and you can better sleep. You can use it for preventively, like every night sleep, just get you better quality of sleep, relax your muscle tension. And also you can use it if your migraine started, headache started just earlier. If early enough, if you can lay down, usually very hopeful. Okay, next. Okay, they I really like Dr. Bernstein say, you know, every 20 minutes move out, you know, get your eye out of your screen. You can watch all the stuff, you know, don't say every 20 minutes, but once in a while, or maybe 3 times a day, tap into your activities. Just you can sit in, you can stand up and put your hands on your shoulder and trying to circle back, use hold your arm, circle back this motion to do 3 to 6 times, and really slowly engage all your shoulder muscle on the back way, in the way they can really relax all this big muscle we talked about earlier, you know, on our back or our neck. And you can repeat a few times. It can be very helpful. Okay, let's talk about like an ear pull technique. Literally, it's always see this cranial bone is a brown area. It's with a temporal area, usually connecting with our intracranial membrane very closely. So sometimes we saw our migraine headache attack, we feel so our head is so squeezed together. So for how to say, balance your pressure on your head, you can gently take your ear and laterally, posteriorly, gently use 5 grams. No, please don't use 5 kilos, just 5 grams, like 1 ounces, gently pull outside and gently open your mouth too. In this way, you can feel little by little your pressure on the head will release and possibly relieve your headaches. You can do again preventively or in the moment you need it. Okay, next. So the last part I'll talk about acupressure points, and you know, so acupressure point 2 point. It's next. One in the hands, one on the feet. On the hands, you probably knowing this is a large intestinal force points. Literally, the location is between our thumb and index on the if you can go up there, you press the point there. This point is really literally help everyone, any type of headaches, any kind of pain literally on your body, and specifically related to any facial pain, any tooth pain, anything associated with our migraine, even the digestion issue. So just to press the point with some pressure. Sometimes I just use like pen and touch there, put just deeply. This time you probably need a little bit heavier than 5 grams. Just stay there and you can feel it, some relief on your head, especially if you do opposite. Imagining I have a right temple pain and the right teeth pain are related. I probably use my left hands and opposite way, in the other hands. So that's the one we say LI force. And the next, one other point is on the feet. We say level 3 points. That's the liver meridians. So the easy way to find it, just use your only 3 fingers on the top between your big toe and the second toe. Go to the top area. You usually feel this point very sensitive. This point usually related to any forehead migraine and top of the head, and some like dizziness and the vision issue. They all related with all liver meridians. That also can do preventively and in the moment if you need it. And even I talk about, I use this 2 point regularly myself. You can use a hands on the RI4 or the liver 3. You can use it together. In Chinese medicine, we really think this is the gate points to help stimulate a rebalance of meridians. Okay, I will stop here now and open for any questions. And I know it's very short, but it's probably already past the time now.
No, you're good. It's 2:30, but so let me see if there's any questions. I have a question. Where do we find a craniosacral therapist? I will fly to Boston to see you guys because everything I saw is exactly where my pain is. So I already have my ticket booked, but where do I find one? I'm obviously not in that area.
Craniosacral therapy in the US point, I should say, they have a few like 2 major schools. The one I had the training is through Acupressure Institute from Florida. So if you check with the acupressureinstitute.com, you can find the funding therapist, and they give you all list of the therapist name around the country, around the world. It's probably one of the fastest profession growing right now in the 21st century.
Wonderful. When we're done with you here, could you put that in the chat so people could?
Sure.
Wonderful.
Sure.
And and so I was going to say too, so all I've heard, with the TMJ and thing, the only thing I haven't heard of this type of therapy is just like trigger point injections and things like that to help. So
yeah, it's a little bit
right.
Yeah, it's a bit different. I mixed with craniosacral therapy with acupressure work because I usually put it together. But as craniosacral therapist, we palpation skill. It's really whenever your body showing where we go, we usually going together.
Okay. Yeah, this is fabulous. I'm just thinking of a bunch of people that I have in my support groups that have, a lot of TMJ and things like that, which cause their migraine. So I can't wait to pass this information on.
Thank you.
Yeah. And Carolyn, yeah. Would you like to say something, Carolyn?
Sure. Yeah, hi, everybody. So I just wanted really, I don't know if any of you tried these things as she was describing them, but the ear pulling and the pressure in this web space, you gave such a great description. And then that area on the foot, those are things, if you're in the middle of a pain episode, I just really, together with Jie, just encourage you to try them. They're easy things to do at home. And Jie, I've heard you talk about the tennis balls. I've tried that. It just feels really, really good. So you gave us such a great description and some tools to use along with Meredith's wonderful meditation. So that was terrific. And yeah, great talk.
Thank you.
I totally agree. I love how you said to put the tennis balls along with the meditation. There you go. You have your 20-minute meditation, right? You have your meditation along with the tennis balls, and there you guys go. You have it right there. If you do it every day, we're gonna feel better. Yay!
They combine them very well, but try and don't watch TV. That's different.
yes, right, exactly. So I'm so excited to try all these and get my plane ticket to Boston. Yes, thank you. And don't forget, these sessions are being recorded, so we will get it on our YouTube. It takes some days for us to to get them, what do I want to say? I get taken off, actually, is what I'm trying to say, and everybody gets spliced out in their little presentations. So they will be put on YouTube, so you guys will be able to watch all of this again. So I just wanted to let you know that. And I thank you very much. Your presentation was wonderful.
Thank you. I just use one word. So the ear pull, please use it when you take off the airplane and the landing. It's very helpful.
Oh, great idea. Yeah, great idea for that too. So thank you.
Thank you.
So appreciate it. Let me move